Birth Boot Camp actually provides quality experience from a lot of different care providers. So the people that went into composing this program were midwives, they were childbirth educators, they were doulas, they were physicians, they were chiropractors. So the information that you get in Birth Boot Camp is more comprehensive than any other course out there.
The difference between Birth Boot Camp and other childbirth classes, and by our observation, is the preparation. These parents and couples are so prepared when they come in to have their babies, and I tell people constantly that when I walk in the room, I can tell the difference. I immediately know that they've had Birth Boot Camp training. Parents or mothers have no fear. They are prepared to have their babies. They cope well, and at the end of their birth, they have a good experience. Not only did they get the birth that they wanted and experienced birth the way that they wanted, they end up with a positive birth experience.
My couples, if they have not ever had an out-of-hospital birth, then they have to take a natural birth class. And Birth Boot Camp is my #1 pick of all of those. There's a variety of different classes out there, and they all have good things to them, but Birth Boot Camp is well-rounded. I mean, it majorly hits the nutrition, it hits the exercise, it talks about their personal relationships together and during the pregnancy, things that you're not going to get in a regular birth class. So I really feel like my couples that go to Birth Boot Camp do so much better.
In my opinion, the thing that really makes Birth Boot Camp stand out above some of the other childbirth education resources that are out there is the fact that it is 10 weeks long. And I know I've had some clients that think, well, why do I need to have 10 weeks worth of education? But really, it's about, just like with the labor being a marathon, being educated is a bit of a marathon, and it's week by week, you're building blocks, really, of information.
A more educated, informed patient during pregnancy will do much better and will have a much better experience during the pregnancy, during delivery, and afterwards with the baby. And I couldn't emphasize the importance of preparation, the importance of being well informed, and that especially for first-time moms.
I love the fact that week after week they get educated on nutrition, they get educated on exercises, they get educated on birth, and no matter what, by the end, they are going to have a whole bunch of information and knowledge that they didn't have when they first started out.
I love seeing people come in and asking questions. What about vitamin K? What about erythromycin? What about exercises? And asking all these questions based on things that they're learning in their class. You can tell that they're soaking up the information and actually applying it to their lives. And it gets couples involved as a team rather than mom coming to prenatals and dad staying at work because he can't get out of work. Even if dad can't come to prenatal visits, it gets him involved in the care of the pregnancy. And you see a lot of dads take a more vested interest in the pregnancy because they know their role. They know what they're supposed to do. They know how to help mom. They know how to be a partner, a birth partner, rather than just a participant hoping that everything comes out okay.
When they start their classes and they come back, we're getting a lot of good questions, a lot of good knowledge base, and it's making their whole pregnancy experience better. It's really making them in tune with their body, in tune with nutrition. It's very comprehensive. It's not all about the pain management at the end. It's much, much more than that.
And I've really been impressed with the level of education that our patients receive, because sometimes before I even explain to them what the situation is and why we need to do things differently, a lot of times before I even approach them and tell them, they kind of know what's going on and what direction this process may go. And so really that level of education, it helps us in our job, in our work.
I used to just tell my clients, hey, you can go find a class, and I left it up to them to decide. And generally speaking, people will try to get away with the least amount that they have to do. And myself as a midwife, if I don't tell them this is the benefit of having 10 weeks of education, they're going to go to a one-day class. But what that means for me as a midwife is my labor time and my time that I'm spending with them in prenatals, answering their concerns and their problems and their frustrations and dealing with their diet issues. I get to spend a lot more time with them versus they're getting educated by a different person, and actually hearing it from multiple people makes it seem more true.
I've seen a lot of people come through that have had very long labors or even very short labors or just labors that are unexpected in some way, and I don't have to backtrack and do a bunch of fix-up work to make sure that those people know this is okay, this is normal. We're already there. We already know that this is okay, so I don't have to do that work for them.
I almost require it, you know, for our families. You know, we really want our moms to have that education, so that when we come in, you know, our role is different. We're the provider. We do offer some labor support. We're midwives, and we love doing that, but it just makes it easier when they can work with you as well, and they can work with their body, and they understand the what's happening to them, and overall it makes our job so much easier.
When I was pregnant with my first son, we actually went through a whole birth boot camp class together because I wanted to be a mom. I didn't want to be a midwife during my pregnancy, and I wanted my husband and me to be on the same page about all this. He is a huge supporter of everything that I do and as a midwife, but this was our baby and our pregnancy, and I felt that it was very important for us to be parents through this whole process and not care providers. So as a care provider, it was important enough to me to receive the same education that all of my patients get, that I went through a course myself.
It's an amazing turnabout that takes place when they go into birth boot camp. When you talk to the dads and about taking this class, they're rolling their eyes and, you know, and all this sort of thing. But right out, even after the very first class, they light up. They're like, you're right, I love it.
I have found that birth boot camp really impacts the dads in a really positive way and gives them those tools and that confidence that they need to really support mom in labor.
They are so committed to the process and so committed to that wife. And what it does between that husband and wife for them to be able to work like that, it's a miracle.
Knowledge is power, and it dispels fear. And it's not that taking a birth boot camp will give you a guaranteed outcome of a vaginal natural birth with everything that you wanted. But what I have seen with my clients is even when the outcome is unexpected, they end up transporting. The satisfaction is totally different than when they haven't been prepared, because if they get transferred, they know what to expect. They understand what the next step is. If there's a complication, they understand. And that right there is one of the most powerful things that I think birth boot camp can do for a midwife and her practice.